is at the anterior border of the sternocleidomastoid muscle, the anterior border. There you can see it. It is a case of branchial anomaly which arises from the third branchial arch. As he eats, the saliva is coming out of the fistula. You can see the saliva there. As I told you, it is a rare case because it is arising from the third branchial arch. Usually get in the first and second one. The first one usually see in the preauricular area. The second one you get in the upper part of the neck. This is the lower part of the neck, it's the third arch. The inner opening is usually seen in the piriform fossa. Here you can see the saliva which is dribbling down from the opening of the branchial sinus. And surgical excision is the line of treatment. We inject a dye into the lumen of the sinus, and you can see the dye being injected into the sinus. The dye is being injected there. And then we do a transverse incision is made, which also involves the opening of the sinus. The skin is also included in there. Track, and the track is dissected from below upwards. Usually we make a cell adhesion, which may be employed to limit the surgical scarring. Dye inside the duct, the whole sinus is being dissected from below upwards. It is maybe higher in the neck. So we would like to make one more incision higher up, as I mentioned about the step ladder incision. In all these cases, an external approach is always necessary. Though the opening is near the piriform fossa, I almost dissected the sinus and it is going higher up. Dye we situated inside the lumen of the sinus. It is going higher. You can see the dye inside the tract. You have to be very careful in this area because the great vessels are present. Sometimes it goes behind the great vessels or in between the external and the internal carotid artery. There you can see the sinus which is brought out from the second incision. And it is almost the level of the piriform fossa. Sometimes the tract, the inner opening may be present even in the nasopharynx. We are clamping the upper end. You can see that the tract is almost reached the upper end. And now we are cutting it, and that is transfixed. You can see the full length of the tract which is excised. Here you see one more similar case of a branchial anomaly. Here it has formed a branchial cyst on the left side in a young man. The incision being made, and you are seeing here also a transverse incision being made, and the cyst is identified. These branchial anomalies are usually seen, but sometimes the symptoms develop in the elderly. There you see the cyst being dissected. Here also you can see that dye which has been injected there.